Hey there. Ready for a deep dive into a case that really pushes the boundaries of veterinary neurology?
Absolutely.
We're going to unpack how vets borrowed a technique from human medicine to treat a really tricky condition in a Springer Spaniel.
What makes this case so interesting is that it involves intracranial arachnoid diverticula.
Intracranial arachnoid what?
Yeah, it's a mouthful, IAD for sure.
Okay, much easier.
Basically, they're fluid-filled cysts in the brain.
Gotcha. Cysts in the brain, not good.
No, not good at all. And to make things even more interesting, the vets used a transcerebellar shunt placement, a technique you see more often in human medicine, to manage this.
Okay, let's break this down. The case report starts with a 3-year-old Springer Spaniel who came in with a bunch of neurological problems.
Right.
We're talking vestibular issues, dizziness, loss of balance, decreased mental state, the whole 9 yards.
Yeah, and the initial MRI showed hydrocephalus,
Which is?
a buildup of fluid in the brain.
Okay, so too much fluid in the brain.
Exactly. So the vets decided to go with a ventriculoperitoneal shunt.
And that is?
It's basically like a drainage system, redirects the excess fluid from the brain into the abdomen.
So they're just trying to get that fluid out of there.
Yeah, relieve that pressure.
And did it work?
At first, yeah, the dog recovered really well. But then about 18 months later, the dog was back with similar symptoms.
Oh no, so round 2. What happened this time?
Well, they did another MRI and it showed a new cyst-like lesion.
Another cyst.
Yeah, but this one was in the 4th ventricle of the brain.
Okay, and that's significant because...
Well, this is where things get really interesting. They suspected this lesion was an IAD. Remember those fluid-filled cysts we talked about?
Yeah.
And the fact that it was in the 4th ventricle, that made it especially challenging.
So was the first shunt still working at least?
It was, yeah, but this new IAD was causing a whole new set of problems.
Oh man, so what did they do?
Well, the vets took a page from human medicine and decided on a second surgery using a transcerebellar approach.
Transcerebellar, so going through the cerebellum.
Exactly. They used a CT scan to map out the safest way to get to the 4th ventricle. They had to be super careful to avoid hitting any crucial structures in the brain.
Yeah, I imagine brain surgery is pretty delicate.
Oh, absolutely. So they placed a second shunt, connected it to the first one, and the whole system drained into the abdomen. It was a really delicate procedure.
So how did the dog do after this second surgery?
Well, there was some temporary ataxia.
Ataxia?
Yeah, it basically just means wobbliness.
Okay, wobbly dog.
But the outcome was really positive, like really positive. 40 months after the second surgery, the dog had a normal neurological exam. Owner said he was back to his old self, happy, active, just a little clumsy sometimes when he got excited.
That's amazing. 40 months later. Especially considering that other reports of 4th ventricle IADs in dogs that were treated with other techniques haven't had such great outcomes.
That's right, yeah. This case seems to suggest that this transcerebellar shunt placement might actually be a viable option for dogs with similar situations.
But of course, more research is needed, right? One case isn't enough to draw any definitive conclusions.
Oh, absolutely. It's definitely early days and just one case. But the meticulous planning and execution of this surgery, especially using those CT scans to make sure the shunt was placed just right, that seems to have been really important for this success story.
Makes you wonder if this transcerebellar approach could hold promise for other dogs with similar conditions.
That's the burning question. Definitely need more research to figure out if it's actually effective and safe in the long run.
So while this case brings up more questions than answers, it also shows the potential for innovation.
Right.
Borrowing from human medicine could really benefit our furry friends.
Absolutely. It's a real testament to the dedication and ingenuity of everyone working in veterinary medicine, constantly pushing the limits of what's possible. Now, let's dig a little deeper into how they actually did this surgery. So the surgery itself is actually pretty fascinating. The report goes into detail about how the vets approached this complex surgery, and it really highlights the importance of planning, before they even went into the operating room.
So they didn't just jump right in. What kind of prep work did they do?
Well, before the surgery, they used computed tomography.
CT scan.
Yeah, exactly. CT imaging to create a 3-dimensional view of the dog's skull.
Okay, so like a roadmap of the brain.
Exactly. And this let them pinpoint the exact location and angle to safely insert the shunt into the 4th ventricle. They were able to identify what they called a safe window on the skull.
I'm guessing that was to avoid any important structures?
Absolutely. They had to be really careful to avoid things like the transverse sinus, which is a major blood vessel, and the occipital condyles, which are bony prominences at the base of the skull.
I imagine hitting those would not have been good.
Not good at all.
Yeah.
So with this precise roadmap, they made a small opening called a burr hole in the skull, just big enough to insert the shunt.
And from there, they navigated the shunt through the cerebellum to get to the fourth ventricle.
Right, and the cerebellum, that's the part of the brain responsible for coordination and balance.
Gotcha. Makes sense.
And they didn't just use a simple tube for the shunt, they attached it to a three-way connector, linking it to the existing shunt that was already in the left lateral ventricle from the first surgery.
So they created a dual drainage system.
Exactly. Both shunts working together, draining that excess fluid from both the lateral ventricle and the fourth ventricle. And then this whole system was connected to a medium pressure valve, which helps regulate the flow of the fluid.
So it doesn't drain too quickly or too slowly.
Exactly. And it seems like this intricate system, this dual shunt system, along with that super precise surgical approach, were really key to this dog's recovery.
It's amazing how they were able to adapt these techniques from human medicine. But even with all that planning and careful execution, weren't there still risks involved?
Of course. Anytime you're doing brain surgery, there are inherent risks. The report mentions potential complications with ventriculoperitoneal shunting in general, things like shunt obstruction, infection, overdraining, or even disconnection.
So risks that any dog undergoing this kind of procedure would face.
Exactly. And the report also points out that in human medicine, shunt placements in the fourth ventricle tend to have a higher rate of complications compared to other shunt types.
So it sounds like that area of the brain is particularly delicate.
Yeah, it seems that way. But it's worth noting that in this specific case, the dog didn't experience any major complications from the shunt.
Which is great news. But you mentioned earlier that they suspected the lesion was an IAD, but couldn't they confirm that for sure?
Yeah, that's a really good point. They weren't able to do a biopsy of the lesion because the owner had some financial constraints.
So the diagnosis was based on the clinical presentation, the MRI findings, and how the dog responded to the treatment.
Right, and while it strongly suggests an IAD, it's important to remember that there could be other possibilities.
Like what? What else could have caused a lesion like that in the fourth ventricle?
Well, tumors are a possibility. For example, a choroid plexus tumor or an ependymoma.
But it sounds like they ruled those out.
Yeah, based on what the imaging showed and how well the dog responded to the shunt placement, tumors seemed less likely. They also considered some other rarer types of cystic lesions like epidermoid and dermoid cysts, but again, those didn't really fit with the imaging and the dog's progress.
So even without a biopsy, they were fairly confident that it was an IAD.
Right, and this really highlights something important about veterinary medicine. Sometimes we have to make decisions based on the best evidence we have, even if we don't have all the pieces of the puzzle. This case is a perfect example of that. And there's another interesting thing about how this dog's condition first presented itself.
What was that? So at first, the vets thought the hydrocephalus was caused by some sort of obstruction of the lateral apertures.
Right, those little openings that let the cerebrospinal fluid flow.
Yeah.
And that made sense based on the first MRI they did. But looking back now, they think that IAD might have been there all along. Maybe it just wasn't visible on that initial scan.
So the first shunt, it fixed the hydrocephalus, but it didn't actually solve the underlying problem.
Exactly, and that's probably why the dog ended up back at the clinic with those same symptoms.
Makes you think.
It really does. And this whole case really highlights how important it is to consider a fourth ventricle IAD as a possibility, even when a case seems like a straightforward hydrocephalus at first.
Yeah, always got to keep an open mind,
Yeah.
especially with these complex neurological cases.
Absolutely. Now, taking a step back from this specific case for a second, the success of this transcerebellar approach, it really raises some interesting questions for the future of veterinary neurology.
What kind of question?
Well, if this approach turns out to be successful in more cases, could it be used for other conditions that affect the fourth ventricle in dogs?
Good question. Could it open up new possibilities for treating other types of cysts or even brain tumors?
That's the crux of the matter. It really makes you wonder what other advances we could make if we keep exploring and collaborating with different areas of medicine.
This case is a great example of the power of thinking outside the box.
It's inspiring to see how these vets took a technique from human medicine and used it in such a creative way, gave that dog a second chance at a happy and healthy life.
Really shows the dedication and ingenuity of everyone working in veterinary medicine, always pushing the boundaries.
This deep dive has been a fascinating look at a complex case with a really hopeful outcome. It reminds us that there's always more to learn, that the most groundbreaking discoveries can come from the most unexpected places.
Always keep our minds open to new possibilities and never stop pushing the limits of what's possible in veterinary medicine.
And with that, we'll wrap up another deep dive. From Vet Neurojar, keep those minds inspired, hearts light, and tails wagging.